virus can kill you. This virus respects no one, respects no race, respects no color, respects no creed. This virus does not distinguish between rich and poor. I will tell you my story and how we overcame. My name is Suraj Ratan Rambachan.
You will hear testimonies from survivors of this deadly virus. This Sunday from 6:15 p.m. on I-95.5 FM and live on the Eye on Dependency Facebook page and YouTube channel. Eye on Dependency. We don't only share stories, we change lives. Don't miss it.
This is Eye on Dependency with Garth and Natasha. Sundays at 6:15 p.m. on the most influential name in radio, I-95.5 FM.
Good evening, Trinidad and Tobago, and welcome to Eye on Dependency, right here on I-95.5 FM, live on the Independency Facebook page and YouTube channel. Good evening, Natasha.
Good evening, Trinidad and Tobago. How are you this Sunday afternoon Sunday evening in an SOE? It's a little different, and we have increased restrictions now because of this COVID, and we are happy to be here to talk with you a little bit about the virus and to hear from survivors. We also have a special guest that we will tell you about later this evening.
Yeah, and that guest is from the Ministry of Health.
Yes.
So representing, she say, and also, as Natasha said, we have the survivors lined up waiting for you, and happy Indian arrival day to all our Indian brothers and sisters here in Trinidad and Tobago.
Yes.
Making it the parallel that it is. So we're gonna hear from those. We're gonna hear from LJ first, then we're gonna hear from the president of the Tobago Hindu Society, yes, Pulati Ramdi. Bipat, sorry, Lord, Pulati Bipat. I'm sorry, ma'am. So sorry. Yes, so Ms. Pulati Bipat, and also former government minister, Mr. Suraj Ratan Rambachan. And believe me, they have really interesting stories. And of course, the surprise we'll have Dr.
Osafo Fraser, who is the county medical officer for health for St. George East, and he will be talking to us this evening about vaccines.
Yes. So you wanna listen to that because it's just the beginning of the conversation. So without further ado, we'll take a break. get you time to line up, sign up, send a message to a friend who you think should be listening. Once again, we have to do this, because substance abuse and its related ills, as we do, this lockdown is affecting a lot of people whom we care for and we look out for. And this is a really rough time for active addicts and recovering addicts, alcoholics, gambling addicts, you name it. See people getting arrested gambling because that too is an addiction. And it's unfortunate. That addict will be looking to sneak out the house in the night while you're sleeping, or find a reason to want to leave the house and have you in a mess, wanting to know it's after curfew hours in effect, and he wants to go out or she wants to go out, and it's really a sad state of affairs. So we want to maximize the time as much as possible. We're going until 8 this evening, and we thank management for that. So without further ado, let's go to that break. And when we return, we'll hear from our first local guest, our first national of Trinidad and Tobago, speaking, well, second last week we had Brent Fraser, week before. But you will hear from LJ Nawan as he will take us through his journey. And of course, the underlying message is what, Natasha? COVID is real.
It does have, as you would know from watching and listening to the news, it is killing people. And it does have certain side effects or lingering effects once you've recovered from COVID. So I'm sure our survivors will tell us about that. And it is something that we need to protect ourselves from, ourselves and our families, our loved ones. And we have to do the right thing. We have to stay home. We have to sanitize. We have to wear our masks and do it consistently in order to defeat this virus and prevent it from taking us.
We'll be back with LJ after this break. Stay right there.
This is reality radio at its best. Eye on Dependency on I-95.5 FM.
Hello.
Hey, how you going?
I'm good.
Long mind see you guys. Someone line by me this weekend now.
Oh, that on the line?
Yeah.
No, man.
You have oxygen in your house? You have a heart monitor in your house? You have a ventilator in your house? You have IV set up in your house?
This is a public service message from Eye on Dependency.
Agricola is back with loan promotions that will make you go wow! The computer and internet bundle CIB loan. Get a maximum of $15,000 with just a 0.75% interest rate. Call or come into our offices at Pro Queen Street, Arima, 667-7633. Pamela's Mall, Marabella, 219-7745. Scarborough, Tobago, 639-6468. Or Port of Spain, 627-3127. Agricola Credit Union, your very own, working for you.
Confused or worried about symptoms during the COVID-19 pandemic? If you only have a runny nose or are sneezing, you may have a cold or allergies. Have you lost your sense of taste or smell? Are you experiencing shortness of breath? These are common symptoms of COVID-19. Coughing, fatigue, and fever are all symptoms of both flu and COVID-19. If you have a temperature above 38 degrees Celsius or 100.4 degrees Fahrenheit, call your local healthcare provider or hotline for medical advice and ask whether you need a COVID-19 test. If you have any COVID-19 symptoms or are waiting for test results, stay home and isolate from other members of your household. Drink fluids and eat well. Always wear a mask if you're in the same room as others. If you test positive for COVID-19, follow your healthcare provider's advice. If at any time you experience a danger sign like difficulty breathing, chest pain, confusion, loss of speech or mobility, don't wait. Seek medical care immediately. Remember, you can prevent colds, flu, and COVID-19 by following a few basic precautions. Stay safe and protect each other. We're in this together. Know your risk, lower your risk.
La Sociedad de Crisis de Violación desea anunciar la línea gratuita y bilingüe para violencia de género, 866-7428. Este servicio es gratuito, confidencial y profesional. Está disponible entre 6 p.m. y 6 a.m. todos los días de la semana. Nuestros interlocutores entrenados pueden hablar contigo en español e inglés y pueden escucharte, guiarte o darte la información necesaria. Llámanos a 866-7428. Recuerda, mi voz es tu voz.
Hello, my name is Raquel, a trainee inmate at HMP Drake, Staffordshire, England, and you're listening to Iron Dependency with Garth and Natasha. Please, people, don't traffic drugs. The money is all that nice. It's not worth it.
Thank you very much for staying with us and joining us via live on we have that 1 minute 37-second video from the World Health Organization that speaks to minimizing your risk. So let's go to that video, and in return, joining us live via Facebook will be LJ.
Yep.
The number of deaths that are being reported around the world is really shocking this late into a pandemic, when we have the tools at hand that can prevent infections, that can prevent those who are infected from spreading to others, and can prevent people from dying. The biggest ways in which we know can limit the spread is around our physical distancing. What we advise in every situation is taking a risk-based approach, because the situation globally is very different. The intensity of transmission is very different. At an individual level, we're asking everyone to know what your risk is through that activity and take measures to lower your risk. Practice your physical distancing, wearing a mask, avoid crowded spaces, make sure you have good ventilation if you're indoors. It's as simple as opening the windows if it's safe to do so. Practice respiratory etiquette, get a vaccine when it's your turn, avoid mass gatherings. We support countries in using this risk-based approach to take the decision about if an event can happen. This is for the Olympics, as well as for having a barbecue in your home. It depends on where you live. It depends on how much virus is circulating. It depends on if there are appropriate measures that can be put in place to have a plan for case detection, for early recognition, for caring of those individuals, for contact tracing, a good communication plan. It also matters about the vaccine allocation and vaccine rollout. Take measures to keep yourself safe, to minimize exposure to this virus and the virus variants, and make sure that you don't allow the virus to spread.
Yes, so that was a short video from the WHO regarding minimizing your risk and knowing what risks you can and cannot take, and the state of emergency is actually one way of enforcing that stay-at-home measure so that everyone's risk is therefore minimized. But we have on the line a survivor of COVID-19. This is
Facebook.
Via Facebook.
Yes.
LJ.
LJ. Good evening to you, and I like the ring to that, so that's why I continue to use LJ. But thank you very much for joining us and agreeing to speak with us and sharing your story with the Republic of Trinidad and Tobago and the world by extension. LJ, good evening and welcome.
Good evening to you and your co-host. Good evening to all viewers and listeners.
So LJ, let's get straight to it. You had an episode. You went to battle, and with the help of Mighty God, you won your battle. Tell us about that battle. How did it start?
Okay, it was a Tuesday evening around 5 p.m. I started just with a itchy throat. And into the night, I started coughing, a very dry cough, what we would normally call like a dog cough. And it was very annoying. I just took some Panadol multi-symptom, and I went to bed. I woke up Friday morning to prepare to go to work, and I was unable to really move. I experienced a lot of intense body pains and chills. So I called my supervisor and told her what was taking place, and she told me to rest. Saturday morning, a headache came. It was very unbearable, and it lasted all day. So I decided to go in the evening to the health facility in Arima, where I was tested and sent into quarantine. In quarantine at home, the symptoms that I was experiencing persisted. There came shortly after high fevers. I was having a lot of problems. I couldn't speak because the cough was unbearable. The Tuesday following, I received a phone call from the CMO, from the county medical officer, saying that I tested positive. So I had to remain in the quarantine. Symptoms worsened. I started vomiting everything I ate. All I was eating was basically fruits and fish broth, but nothing was staying on my stomach. Even if I sip water, that would come out immediately. It became very severe, and on the Friday evening, we had to reluctantly call the AHS for assistance. I was taken to Cora Hospital around probably like 6:37 p.m. on the Friday. At Cora, I received minimal medication for the symptoms that I had, but then it worsened. The vomiting was non-stop. So I was unable to really eat because nothing was staying on my stomach. I coughed uncontrollably. It caused a lot of belly pains and chest pains. I had to be placed on IV as I wasn't eating. I can't say exactly what day it was because I was mostly disoriented. I started having dizzy spells. And one evening, just as the nurse was about to take my vitals, I had a blackout. I woke up in a wheelchair. I can't say how long after. And all I remember was asking for water. They bought a cup of water for me, and I was unable to drink the water. So they had to feed me with a syringe. They placed me on a different bed where they could have monitored me closer. I was placed on oxygen and also a machine to monitor my heart rate because I was told that my heart rate went very low. I had never experienced anything like this before. I am healthy. I would normally get a regular cold or flu, but nothing like this to reach the hospital, so it was very scary. I was told that I was no longer allowed to come off the bed because I was on the oxygen and this machine to monitor my heart and also my so the treatment continued. I got a lot of meds through the IV access. I wasn't getting medication orally again. Vomiting persisted throughout. I remember requesting to have a bath, and I was unable to go because none of the medical staff was willing to take me to the bathroom. I was on that bed probably about 4 days or more without having a bath. One day, a nurse decided that she would take the chance, and she took me off and allowed me to go to the shower. And I was unable to shower because before I took about 3 steps away from the bed, I passed out again. So I woke up on the bed and I was told of what took place. It got to the point that I actually vomited blood. I brought up some blood. I continued vomiting, just bringing up a bile because I had no food in my system. And I was taken to the Couva General Hospital for a scan on my stomach, a CT scan. Thankfully, that came back good. They brought me back to Quora Hospital, and doctor asked how did I feel, and I told her I was feeling much better, and they decided to send me home. I was also having some problems with remembering stuff sometimes. So like, as I said, I was also having high blood pressure at times and low blood pressure sometimes. It was fluctuating a lot, and they told me I am stressing myself and thinking about it too much and just pray and relax. But it was difficult because when you're in that position, you can't stop thinking about what is taking place. You would try. Sometimes I would just find myself crying, and it was very scary.
Did you at any point in time feel that you're not going to make it?
Several times. Several times I felt that way. There was an evening I was going to bed. I was feeling like steam, heat was coming through my nostrils and my eyes and my head. I called on a nurse, but that day the staff, I don't know if they were tired, they weren't too friendly, but no one came and checked on me. And when the shift changed the evening, the nurse did my vitals and I was told I had a very high fever, but I was unable to go to the shower because I was on oxygen. The fever was actually 38.8 degrees. Another patient who was on a bed nearby gave peppermint oil, and they gave me Panadol again, and that assisted. When I was sent home, they took all the IV access. I came home still having a lot of symptoms. The coughing was there, the disease spell was there, but just less. It persisted for a few days, the disease spell. The coughing persisted for about a week after. However, those symptoms have subsided, but I still have the fatigue. You're always tired. I would now get up from my bed and walk outside, and 5 minutes after, it's like if I was up all night. I need to go back to rest. Can't do anything much. The short breath, if I walk too fast or walk too much, I would be out of breath. Going downstairs, it was difficult at first. I had no strength at all in my legs. I had to hold on to the railings, and that was difficult because my hands were still sore from the IV access. I actually had 4 different IV access because after periods of time, my vein were collapsing. One of them, the medication was actually not going to my veins. It started saturating my tissues and caused a lot of swelling. To this day, it is still a bit swollen and sore. I can't put on a wristwatch because it causes problems.
Wow. Can you tell us how old you are, LJ? You look like a young guy.
I am 33 years of age.
Wow.
33.
With no other health issues?
None at all.
Any side effects?
I
I'm
don't
in
know
recovery
if
now.
it's still, I don't know if it's still the lingering symptoms and bacteria causing it or the amount of medication, but sometimes I get headaches and feel dizzy now and again. Not as bad as before, but it's there. The fatigue is there.
No, what I was just gonna ask, what would you say to other persons your age or older or younger about your experience with COVID? What would you advise them?
And before you answer that, were you physically fit? Were you you work out and stuff?
Semi-professional cricketer.
There you go.
Since COVID came, well, the sports stopped, but I played at the National 1 level, represented the police service.
There you go.
So
as Natasha asked, what would you say?
The virus is very serious. I didn't take it for a joke, but I didn't think that it would happen to me because I was doing everything that I was supposed to do. I was doing everything. I don't lime, I don't party, so I wasn't missing anything. I wasn't under pressure there. I don't smoke, barely drink alcohol, and I am very active every day. When I'm not at the police service working, I am doing enjoyment at home. I have my own workshop. So I am not a person. Like, the only time I would have left home is to go to the supermarket or to the hardware and come back home and go to work. And that's it.
Can you remember where you think you would have picked it up?
That's the scary thing. I have no idea.
Oh.
I have no idea. That's baffling.
Yeah,
and
no, go ahead.
Listen.
No, go ahead. Go ahead.
Yeah, what I would say is that the virus doesn't look at complexion, texture of hair, age, size. If you are fit, if you are unhealthy. I thought that I looking at the stats, mostly older persons were getting it. So I felt a bit safe. And I actually thought I had a common cold as I would get. And when I got the results that I was positive, it broke me down mentally immediately, because I was so shocked. I wasn't expecting it, even though I was really ill. I just thought my resistance was low because I am always on the go. I barely take vitamins and tonic and this stuff. So it was a burden mentally. It still is, because I am not able to do a lot of the things that I usually do. I am now trying to get back to myself. While at the hospital, I would have seen a lot of persons there who are even younger than I am. Some with mild symptoms and some very severe, on oxygen right through. So you have to just be careful.
Sorry, LJ, if you're just joining us, you're listening to Independence. I know there's a little delay, right? So we will work that out. But I'll just say to the folks, if you're just joining us, you're listening to Independency, and we are speaking with LJ via our Facebook page live. So you can pick that up there on our YouTube channel or Iron 95.5 FM. Good evening to our listening audience. And LJ is just taking us through his experience with contracting the virus. He didn't know how we get it. Yeah, 33 years old, fit person, cricketer at national level, and still picked it up. LJ, you live alone?
No, I live with my wife and my children.
And what was their status? Did they contract it or they still negative?
Thankfully, my children, my two sons, tested negative. They are 6 and 5 years of age, respectively. They tested negative, but my wife wasn't as fortunate. So we had even further problems there, where we were all together at one time before I knew I was positive, before I felt ill. So there was a great possibility that they could have contracted the virus. So when my wife fell ill, we had to come up with a system. Well, she had to come up with a system, because when she found out, I would have already been at the hospital. So we were not able to send them to any relatives. They usually stay with my parents, who have comorbidities and they are ageable. So it was too much of a risk. So my wife told me what she would have done. She would have quarantined in her room and ensured that they stayed in their room, and she would get up early in the morning, prepare their meals for the day, and sanitize the place as best as possible. And they were basically unsupervised because we had nobody to look at them. Right. And they are 5 and 6. There was an incident when my son tried to, the 6-year-old, he tried to microwave a sandwich.
Oh, no.
And I don't know how long he put it for. My wife had to rush outside because the entire house filled with smoke. And that was one of the problems we faced.
Wow.
It's easing up a bit now, but we still try to distance ourselves as much as possible. My children are being shown affection. They are accustomed to physical affection every single day, hugs and kisses. And it has been an entire month where they were not able to have that. So it's telling on them as well.
Do you have to wear a mask at home as well too?
I am now kind of eased off of it. My wife isn't pleased with it, but it is very tiring because I still have a little shortbread. But once I am close to the children, I have to wear it.
Wow.
So I still try to minimize physical interaction with them. Thankfully, we had a lot of support. A lot of support. Persons, my parents, friends would cook for us and drop food downstairs and leave, and when we go, we would go downstairs and get it. And we had a lot of persons waiting for us, a lot. The support has been tremendous. From the time I was ill, it still continues. People check on us every day, call, message. It's overwhelming. And I am really thankful for all the prayers and support I have gotten and my family have gotten from friends, even my colleagues. They went above and beyond. They came to the hospital almost every day to drop off supplies to me, anything that I needed. And they checked on me every single day, my supervisors, my senior officers, even my peers, they checked on me every day and continue to do so. So I am very thankful and grateful for that. And I can only think about the persons who doesn't have that support system in place, the mental pressure they would be under, because it is still mentally tasking for me. It is frustrating, to say the least. Sometimes I would feel, then other times I just get up angry. And I'm still trying to come to terms with what happened to me and accept it as difficult. So I can only think about the person who are unfortunate financially, who doesn't have anybody to help, the pressure they would be under, and the stress.
So, Jabel, before you go, once again, as Natasha, what would you say to young people out there, especially who think that they made out of iron and they wouldn't catch this? What was your final word for them? And of course, everyone in the citizens of Trinidad and Tobago.
Well, I thought I wouldn't have gotten this virus because I was young, but we see differently now. I think there was somebody early 20s that died recently. So nobody is special in terms of not contracting this virus. It can take anybody. It doesn't respect age or ethnicity, color, beliefs. It doesn't affect. Those things cannot stop the virus. The virus doesn't respect it. And we need to be vigilant. We need to pay attention and follow all the protocols set. I am not being political, but I would say that the government is really trying. They are really, really trying to do what is best and still be lenient on the citizens. And we are making it harder on ourselves when we do not follow. I cannot wait to return to normalcy. But it would seem so hard because everyone is continuing doing their own things and not following the protocols and guidelines set. And it is very difficult. I don't know where I got the virus from. You don't see it on somebody's forehead printed. And if we continue doing as we want to, it will be catastrophe. I remember the hospital several times I was told that medication was out, the pharmacies out of stock, and we have to wait. What about if you cannot afford to buy medication? A lot of persons are not working now. Yep. You can't afford to buy medication, you can't afford to buy food. You live alone and you have people come to you. You can't have visitors if you have food. You need to think about all these things. What about the person you care about and love? If you get sick and you go home, I came home. My family was home all the time. They weren't going anywhere. My wife basically worked from home most of the time. And it was unfortunate and heartbreaking that I would have come home with this virus and transmitted it to my family. It is very hard. And I could only think, what about my children? I am not the only parent. So what if you go out and you come back? What I went through, I wouldn't want anybody, another adult, to go through it, far less on my child or another child. They wouldn't be able to make it. There were days I thought I was going to. My children can't be at that thing, and you need to think about these things as well. You can't be being selfish. I feel it to go for a beer, I feel it to go out and sit down by the corner. It's not a normal time, and it's not easy to accept, but we have to.
LJ, thank you so much, my friend. Thank you. And we extend best wishes to you and your family, your wife and your sons. And we wish you all the best, man. You take care, stay strong. We appreciate you. Thanks a lot.
You're welcome.
All right.
Thanks very much.
Thanks very much.
Stay safe.
Take care. Stay safe. Bye-bye.
That
was LJ telling us you can't imagine living in a house, you can't even touch your children, they're in separate rooms. This is a nightmare. This is a literal nightmare. We're behind time already, folks, so let's go to that break. And when we return, we'll be speaking with the president of the Hindu Society in Tobago Hindu Society, Ms. Pulwati Bipat, and she will be telling us why we're hooking up with her via Facebook as well. All right, so we'll be back. Stay right there.
Eye on Dependency, where every life is a biography. On the Eye, 95.5, the most influential name in radio.
Hello.
Hey, how you going?
I'm good.
Long time see you guys. Come on line by me this weekend, huh?
Oh, that's on the line?
Yeah.
No, man.
You have oxygen in your house? You have a heart monitor in your house? You have a ventilator in your house? You have IV set up in your house?
This is a public service message from Eye on Dependency.
They are always with us in both small details and in big ones. Sometimes they make mistakes, and so often they make us feel proud. But they're by your side, always. When you work, when you study, in good times and in bad ones. Today, more than ever, we depend on them. All you need is to wash them properly. Wet your hands. Apply enough soap to cover all surfaces. Rub the palms of your hands against each other and then the back of each one, always keeping your fingers intertwined. Then rinse your hands extensively and dry them. Hand hygiene is one of the most effective measures to reduce the spread of infections. Now we are indeed in good hands.
The Rape Crisis Society is happy to announce its toll-free bilingual gender-based violence hotline, 866-7428. This free, confidential, and professional service is available from 6 p.m. to 6 a.m. each day. Our trained listeners can speak with you in Spanish and English and are available to provide a listening ear, guidance, or information to all who may need. So call us at 866-7428. Remember, mi voz es tu voz.
Agricola is back! Loan promotions that will make you go wow! Wow! 60 to 40 loan. For new members or members with no loan, get a maximum of $300,000 with just a 1% interest rate. Call or come into our offices at Pro Queen Street, Arima, 667-7633. Pamela's Mall, Marabella, 219-7745. Scarborough, Tobago, 639-6468. Or Port of Spain, 627-3127. Agricola Credit Union, your very own, working for you.
Hello, my name is Marsha, and you're listening to Eye on Dependency with Garth and Natasha, Trinidad and Tobago. Don't you dare traffic drugs. It's not worth it.
thank you for staying with us. You're listening to Dependency, and you can join us live on our Facebook page as we hook up with another guest, and of course on the YouTube channel, and live on 95.5 FM UR. We are about to speak now with the president of the Tobago Hindu Society, Miss President, that is, Miss Pulwati Bipath. And she's coming up now. Thank you very much, Shortman, for bringing in Miss Bipath. And folks, I hope you learned from that last testimony you heard. It's really frightening to know that you live in a house with your 2 children, and you live in a house with your 2 children, and you cannot even touch them. You can.
Yeah, that's very difficult. I think we may have to call Pawati on the phone. I don't know if we have the video hookup. We have Suraj on the line.
All right, so you'll have to hold on then. Good evening. All right, so we have a change in guest, and I was hoping to do. Nevertheless, we'll go with Mr. Surajratan Rambachan, and then we'll speak with Pulwati afterwards, right? I think Shortman mistaken, because we're supposed to be going to Pulwati now, but we will have to make the readjustment on the trot and bring in former government minister Surajratan Rambachan. And before we actually speak with the minister, the former minister, we have a video to play, Shortman. And this is our tribute to the Hindu community as we observe Indian Arrival Day. And you all would never guess who is singing on this video. This is a side of the minister that you all didn't know. Well, I was shocked too. So I didn't believe, according to how Sprangalang had a lovely way he used to pronounce his name. Surujbhai. Former Minister Surajratan Rambachan. Shortman, let's go. Let's play that video for them to see. It's really amazing. I was shocked. And of course, after we'll be hooking up with
O children of noble and ancient culture, awake, the time has come to rise. United with courage and strength together, rise up, awake, the time is right. O children of noble and ancient culture, awake, the time has come to rise. United with courage and strength together, rise up, awake, the time is right. O children of noble culture. Our parents came from India land afar, bringing with them their culture, with little but their dharma, full of joy and hope forever. All they brought with them was the culture. When they came here, they planted upon this land the seeds of the culture that they had brought. United with courage and strength together, building a new home in this land for children of noble culture. The days and the nights, though hard and trying, could not destroy their culture, could not destroy their dharma. They were brave and fought like Rama. They were strong and stood by Sita, full of faith, love and vision. Their sons and their daughters rise up to face the task at hand, continue in the work Our fathers started building a new home in this land for children of noble culture. We the young ones of today, our duty awaits us. Now is no time for weakness. Now is the time for action. Let us love and serve one another. Let us strive to build our future. Let us join hands and voices across this land, continuing the work our fathers began. Fearless with courage and determination, building a new home in this land for children of noble and ancient culture. Awake, the time has come to rise, united with courage and strength together. Rise up, awake, the time is right for children of noble culture. For children of noble
And
I think he deserves a round of applause for that,
yes,
because I'm sure many of
round of
you
applause
who
for
are
that.
tuned in on live, on radio, on Facebook, and on YouTube had no idea that this gentleman was so talented. Thank you again, Mr. Rampachan, for joining us.
Well, good afternoon. Good afternoon to you.
Good evening,
And,
sir.
evening.
And I must say, you look well. You look well as a survivor of COVID-19. You look really well. And I
Thank
must say,
God.
good evening to your family too as well, and your brother, Anatanan Rambachan. I hope I pronounced that right.
Yes,
And yes, and he too is a huge contributor outside. Ladies and gentlemen, you see this brother's itinerary and bio. I mean, and wow. I mean, let's deal with the minister, former minister first. Good evening, sir, and welcome to Independency.
Thank you very much. God, you created history this evening,
Really?
That's the first time that song has ever been played on a non-East Indian frequency.
It was our pleasure. Thank you very much. You shocked me when you sent the video. You shocked me when I saw you singing and playing the harmonium. I said, "Wow, we didn't know that."
That song was written 50 years ago, in 1970, by my brother Anand.
Right.
And Professor Ken Parmasad, who passed away, and I voiced it in 1990. Well, we were singing it all, but I voiced it in 1990 with a group of musicians, and that recording is 31 years ago that you just played.
Right. Well, you could have come and stand up 10th man, I guess.
No, I sing really devotional songs, God, and I spent about 52 years so far preaching the Ramayana. I go from village to village, doing this for the last 2 years.
Right. No, former minister, we famously run out of time here, so let's get right to it.
Yes.
You have a message for Trinidad and Tobago because you too won the battle, and your family won the battle against the coronavirus. How did it start for you? When did you know you got the virus, and what happened next?
Well, God, sometimes you don't even realize that you are afflicted with the virus. And it was about 4 days before I went to the Chaguanas Center. I was seeing all of these symptoms, and the symptoms for me were three mainly: 1, fever; 2, body pains; and 3, breathing problems. Those were the 3 things that I didn't have any sore throat or anything like that. But when the fever got very high, fortunately, I was able to go to Dr. Chandradat Bodo, and he injected me with a antibiotic. But I think that I was saved by the fact that I had taken the AstraZeneca vaccine, and that to me mitigated the effects of the COVID. Now, we had it very badly. I would say we came back from the edge, to be very honest with you, because my oxygen had fallen below 90, and my son even lower. And that is a point that I want to delve on. That
you have today approximately 8,331 persons in home quarantine. And they are being monitored by the surveillance unit doctors. But remember, these doctors are not visiting you at home. So these doctors really would not know what is your oxygen level in your blood unless you have an oximeter at home. An oximeter costs about $274. And I want to tell you, God, that is a very important thing, because only with that can you tell what is your oxygen level. And remember, that is related to your breathing problems. Thankfully, we had an oximeter in our home now for about nearly 14 years. And also we had an oxygen concentrator, and we were able to use that. And that really pulled us through, because at one point in time, they wanted to put us in the hospital. And when we told them what we had at home, they began monitoring us. Just think about the people who do not have an oximeter at their homes. How are they going to fare? I would think, that there are two things that the authorities should do in this situation, where obviously the hospital system cannot take more people. And I think, God, that if you check the internet, you'll see that an oxygen concentrator costs about $350. Let's just say you import it as a government, you import it, and if you buy it here, it's $6,000 plus VAT, and that's a 5 liter. Now, God, if we spend, let's say average of $4,000 so on, and if you were to buy 500 of that, that's $2 million. $2 million cannot hurt this country, and have 500 of that available to be lent to homes, and also about 1,000 oximeters that can be lent to homes also, where when you have more serious cases. I think that we have to focus, while we are focusing on the hospitals and the ICU and the high dependency unit, we have to also focus on these people who need to be monitored, I think, in a more detailed way at home, because not everybody would have someone like I have my daughter, liaise with the doctors and doing all that was necessary. So I make a plea on behalf of those who are homeless, 8,331, and that's going to rise, because just today we had 637 new cases, and we have 9,607 active cases in the country. So this is a very serious aspect that I don't think we are focusing enough on, which is the home quarantine people.
But Minister, former Minister, Mr. Ramachan, what was the first symptom for you? When did you know?
The first symptom was the tiredness, extreme tiredness, and the fever, and the inability to walk a long distance. There was a point in time which I couldn't walk more than 50 feet without having to sit down.
Right.
And it got so, one day I remember, I just lay down on the concrete because I just couldn't move. It was difficult even for me to drive my vehicle back home that particular day. So that it really puts you down in a very serious way. But thankfully, I went to the health center and so on. At the health center, they immediately gave us drips, and they put antibiotics in the drip. But the visit to the health center is important, because you also be doing an X-ray of your lung to see whether it's being filled up or what's happening. Because when Dr. Ryan visited us at home at Saturday, he says, "Look, I can't deal with this at home here at all." And immediately he told us what was necessary, and that's how we ended up in the health center.
So you said, you and your family, and you and your wife and family, or how many of you were affected?
My wife and daughter had taken the AstraZeneca,
right,
and they have not been affected at all. They have no symptoms at all. Sorry? And my daughter tested negative during the time she was attending. My daughter attended us all the time. My wife, she stayed in a different part of the house. But God, what happens from whose families have passed away, and they have been calling, asking about my symptoms, is that people are taking too long to go to the health center. And because of that, they are deteriorating, and they do not know they are deteriorating until they get to the point where it's too late. And I know of at least 3 cases where people have died in that particular way. So I want to encourage people, don't wait. Go to the health center as quickly as you can. Don't be afraid to get. Some people are very afraid to get tested. I don't think you should be afraid to get tested at all.
So how long did you stay at the institution, Dr. Ambachan? How long did you have to stay?
We stayed 4 hours that day at the health center.
No, were you hospitalized?
No,
Right.
That's what I'm saying. God, when they started to monitor our oxygen, we were giving them the readings from home, right? When they started to monitor, what happened is that one day they realized our oxygen was too low, and they said they were going to send the ambulance and try to give us oxygen, but we told them we had oxygen. Then they wanted to hospitalize us. We should go to the hospital. But, you know, we fought it. We really fought it at home. And as I said, my daughter was liaising with the doctors, and they really did a good job.
You all still have to observe the mask wearing.
God, I just want to show you something here, if you can see it.
Yes.
I don't know. This
Yes,
is an
you can.
oximeter. How can I put this?
Bring it more to your left.
More to my left? Yeah.
Right.
This is an oximeter.
Right. Yes, we see
You
it.
see
Yes.
103 and 97.
Yes.
97, the most you can go to is 100, right? 97, see 95, you know? Right. I start to breathe. You'll see it going back up. So deep breathing is very, very effective. I am not totally over the hill. So why you see it start at 97 there, and it goes back to 94, I need to keep it back to 97. And that's very, see it goes back up now? Because I'm deep breathing. You see it go back up? No, 98, you see? 99. And that comes from deep breathing. So you cannot depend on the machine all the time. You have to depend. This is very interesting, God. This is the first day that my oxygen has gone to 99. And then it happens to be on your. But once it's you have to get back to deep breathing. And this little called oximeter is a very important, because this is the only way you're going to monitor what the blood level is, your oxygen is in your blood level. And that's what I'm saying. You can invest. I have bought some that I'm going to donate to the health center this week, so that they can give to people in India and who need to have one at home.
Okay.
But the oxygen concentrator, God, you know, we have short time, but we have priorities where the priorities are right. And the oxygen concentrator is very, very important. Look, UNICEF has just given out 40,000 oxygen concentrators in India, because they understand the importance of putting that in the hospitals and home. Salman Khan, the actor in India, he donated 500 oxygen concentrators in India. And so people know the importance of the oxygen concentrator. And I told Mr. Imbert recently, you know, he listened to me, and I thank him for that he should invest some money in these oxygen concentrators and in the oximeters, which are very, very important.
Now, Dr. Amachan, where can people are asking as well on Facebook? Where can you purchase the oscillators?
Well, God, it's very interesting. If you go on Amazon, you can buy one for between $7 US and $12 US.
Okay.
In Trinidad, the people who sell it are selling it between $175 and $274.
Oh Lord.
Yeah.
Okay. Okay.
But on
No.
Amazon, I bought quite a number on Amazon, as I said, and I'm giving it to the health center to give people.
Well, as we wrap up, sir, is there any final message that you have for our audience and for Trinidad and Tobago?
Yes. I want to tell people, don't take this for a joke at all. Don't take this as a joke. Don't stay home with it. Please don't stay home with it. Go and get tested as soon as you see signs of it. And don't wait to be told to isolate yourself from the rest of the family. If you see signs, begin in your own home to do the isolation and do the quarantine. Because there are a lot of people who are asymptomatic walking around with their disease. And that's why I think that we have this explosion also, because people do not know that they have it. And finally, you know, COVID kills. And we should take it very, very seriously. And this is a matter of life and death. And every time we lose someone, we have lost a valuable human resource in our country. Especially when we lose policemen, we lose frontline medical people and so on, and we lose the grandmothers and the grandfathers. And now, God, look at the 34-year-old in Tobago has died. No comorbidities, no in Trinidad, no comorbidities. So this virus is not discriminating between rich and poor, young and old again. It's something that's going to attack everybody. And therefore, we have to treat the situation as if everybody is afflicted with COVID and take the precautions that are necessary.
Thank you so much.
Yes, Dr. Amachan, thank you so much. And before you go, folks, I just wanted to put something on the table here, Dr. Amachan. After all these years, when I called him, he said to me, God, I listened to your program all the time when I could. And he said, I wanted to add something to your advertisement every time you almost know. And he said, and his words were, we don't only share stories, we change lives. And that hit me really, really well. And so from now on, folks, when you hear our promo and you hear that in it, thank Dr. Rambachan for that.
But God, on a very serious note, and I really mean this, I was a talk show host for over 15 years on a program 4 a.m. to 6 a.m. every morning. And you have one of the best, most formative, well-researched human interest talk shows that I've heard in this country. And I genuinely and sincerely compliment you and your team for producing such a program. And I really wish that more people would listen to your program, especially when you deal with those who have fallen through the cracks in terms of drugs and what have you. But your human interest aspect of this is something that is outstanding, and it is what will change lives.
Thank you very much, sir. And as I said, when here we not only share stories, we change lives. Thank you, Dr. Surajratan Rambachan. God bless you and your family.
Guys. You
Happy
too.
Gen Arrival Day. Enjoy your holiday tomorrow.
Thanks for playing my song.
You're welcome.
You're welcome. And thanks. I mean, you really impressed our listeners.
You see, God, I'm smiling now. That tells you how well I'm recovering.
Yes. And God bless you and your family for that. So take care. Keep in touch.
All the best.
All the best. Take care. Bye-bye. Right. So, folks, that was via Facebook Live. Surajratan Rambachan.
Yes.
And giving us some good advice there too with the is oximeter, you call it?
Oxygenator.
I
think. I'm not sure, but it measures the level of oxygen in blood.
And he did a demonstration for us live.
Yes.
So let's go to that quick break, and then we come back via phone. The president of the Tobago Hindu Society, Ms. Pulwati Bipatashi, and then after that we will speak with Dr. Osafo Fraser. And he will tell us all about the vaccines. That's important word, vaccine. We'll hear about that and more when we join us again. Stay right there. We'll be back.
You're listening to Eye on Dependency with Garth and Natasha. Reality radio at its best.
Hello.
Hey, how you going?
I'm good.
You know, long time see you guys. Come online by me this weekend, huh?
Oh, that's on the line?
Yeah.
No, man.
You have oxygen in your house? You have a heart monitor in your house? You have a ventilator in your house? You have IV set up in your house?
This is a public service message from Eye on Dependency.
Parents, employers, the COVID-19 virus may have brought financial and emotional stress. Coping with these stresses can lead to making unlawful decisions, like taking a child out of school to work in order to help the family survive. It is illegal for children below age 16 to be employed in Trinidad and Tobago. Replacing a child's education with work is child labor, which is a serious offense and attracts a penalty of up to $25,000 and 6 months in prison. Do the right thing. Do not make our children victims of child labor. Visit TT Connect at www.ttconnect.gov.tt for psychological and financial support services. If you spot child labor, report it to the Labor Inspectorate Unit at 299-0300. Option 3. Childline at 131 or the Children's Authority at 996. Commemorating the International Year for the Elimination of Child Labor. A message from the Ministry of Labor.
Agricola is back with loan promotions that will make you go wow! Wow! 3-to-1 ratio loan for any type of construction. Get a maximum of $300,000 with just a 1% interest rate. Call or come into our offices at Pro Queen Street, Arima, 667-7633. Pamela's Mall, Marabella, 219-7745. Scarborough, Tobago, 639-6468. Or Port of Spain, 627-3127. Agricola Credit Union, your very own, working for you.
Hello. Good.
La Sociedad de Crisis de Violación desea anunciar la línea gratuita y bilingüe para violencia de género, 866-7428. Este servicio es gratuito, confidencial y profesional. Está disponible entre 6 p.m. y 6 a.m. todos los días de la semana. Nuestros interlocutores entrenados pueden hablar contigo en español e inglés y pueden escucharte, guiarte o darte la información necesaria. Llámanos a 866-7428. Recuerda, mi voz es tu voz.
Hi, I'm Danielle, and you're listening to Eye on Dependency, where every life is a biography, Trinidad and Tobago. Don't traffic drugs, it's not worth it.
Thank you for staying with us. You're listening to Dependency right here on 95.5 FM, live on our Dependency Facebook page and YouTube channel. On the phone line, we have the president of the Tobago Hindu Society, Ms. Pulwati Bipat. Good evening, ma'am.
Good afternoon, sir.
Thank you very much for joining us.
You're most welcome.
And you should say Sitaram to you too as well.
Yes.
How are you, Ms. Bipat? Thank you very much for joining us. And please tell us, send your greetings, and you can tell us what happened and you survived this war with the virus, you and your family.
Okay, thank you very much. Sitaram, and a pleasant good night to Trinidad and Tobago. My name is Pawati Bipat of Starwood, Tobago. Today, I would like to share my story of being a COVID-19 survivor. On the 1st of August 2020, I visited my eldest daughter, Geeta, in Trinidad for the weekend. On returning home after 3 days, I started feeling ill. I had some symptoms of sore throat, cough, high fever, and weakness. My youngest daughter, Sita, bought me some medication at home, but my health was still not improving. My daughter, Geeta, in Trinidad, called my son and said she had to go for a COVID test because a co-worker of hers was tested positive. The same day, Geeta went for her test and her results came back positive. She was sent for quarantine. My son took me the same day to get my COVID test, and after 2 hours, my test results came back positive. I was told I needed to wait until I could be transferred to a quarantine facility. While I was awaiting transfer, the nurses there, they did their regular check, and they hooked me up with they started IV fluid, injection, and I got Panadol to see if my symptoms would ease. I waited from 5 p.m. to 2 a.m. until I was transferred to the old fort for quarantine. During the course of the day, my illness became worse, and the nurses continued with IV and injections. I had breathing problems in the night, and I felt as though I was dying. I called my son and my sister, and I told them I was feeling as though I would not make it through the night. I called out to the nurses and the doctors for help, and when they came, my body was cramping, and I could not breathe. They decided to start me off on oxygen. After 1 hour, I felt a little bit of relief. The nurses checked on me regularly during the course of the night to monitor my condition. I was given lots of water to drink because I could not digest any food due to my condition. The following day, my symptoms reduced and I felt a lot better. I started to eat and drink meals provided and tried to walk along the corridor on my own. A nurse notified me that my son was tested positive and she will bring him to visit me. When he came to see me, he said he was so happy to see I was improving due to the severity of my illness over the past few days. And he is here now, so he will check on me when necessary. The following day, my youngest daughter also came to the facility because her test results came back positive. Although her symptoms were very mild, after 4 days, my son's 2 children and his wife came to the facility because the wife and daughter tested positive and my grandson was tested negative. They did not receive any treatment or medication besides breakfast, lunch, dinner, fruits and juices. But friends and family members supported us by sending medication, clothes, food supplies, and different things for the children, for the family. My granddaughter Mia, who she is 5 years, was praying for everybody who was tested positive in our COVID facility. Every evening, she would come to the different rooms where her grandmother was, her parents was, her daddy was, and she would ask everybody to join in hands with prayer and ask Jesus to take away our sins, take away this COVID sickness from us, and let us get better to go home soon as possible. After our second COVID test results came back, I was tested negative. Some were sent to their respective homes and some were sent on step-down facilities. However, I was sent home. I would like to thank all the doctors, the nurses, the pastors, the pundits, the friends and families who supported us. I want to say a special thank you to Ms. Diane Haddad, the Gopi family, Nisha Gusine family for all your assistance during that difficult time in our lives. I would like to thank the radio, I-Next 5.5, Mr. Garth and Natasha Sinclair for giving me this opportunity to share my experience with you all. I thank God for the blessing for my family. My advice to everyone is please wear your mask, sanitize your hands, keep social distancing, be safe. This virus is very dangerous. I want to say Sitaram to everyone. Do have a happy Indian Arrival Day as President of the Tobago Hindu Society, and God bless. Thank you very much.
Well, Ms. Piotr, before you go, how is everybody doing now?
Well, everybody is okay now. Everybody is back to work. The children are back to work, and everybody is okay. You can move on good.
Well, we're really grateful that you made it back, and
I must thank the Lord for that. I always tell my children I think I got a second life because I was very, very sick. And I thank God for giving me that blessing to be back.
yes, and any final warnings to our people, the hardened people, especially of Trinidad and Tobago?
Well, I want them, especially in Tobago, know that we have this thing. This thing is so much in Tobago that, we have to be very careful. We have to wear our mask. We have to be home. We have to sanitize. We have to be social distancing. If you see that you are having the virus, you are having the fever, you are having symptoms, please visit your nearest doctor because this COVID virus is not scaring anybody at all. My talk to them, my advice to them is to please be safe. With God's blessing, let us hope that this virus will go away someday.
All right, my dear.
Well, special thank you for having me on this program tonight.
On behalf of Natasha and I, and of course the by extension, the people of Trinidad and Tobago, the Ministry of Health and the all the nurses, the frontline nurses as well, frontline workers as well too, who took care of you. I know you
Yes,
spoke highly
all
of them.
frontline workers, yes, all the
Yes.
officers and all those people. I want to say that they're safe, all the doctors. I remember when we were at the hospital and the doctor would come to check the patients, and then my granddaughter would say to the doctor, and the doctor would smile after. He would sit down and he would wait, and when she finished say her prayers, he would smile and say, "Thank you, Mia," and he would go about to the next word. And that is children at that age, and they were so scared about this virus that was going on. And we all have to come as a family, get together, and make sure that, unity is what we need at this point in time.
Thank you very much. God bless you and your family. All take care, right?
Okay, thank you for having me. Thank you, bye-bye.
You're welcome. And you can visit our Facebook page too as well, Ms. Yvette and your family, to see the comments from the people, from the listeners and the viewers, right?
Okay, thanks so much.
Okay. Take care. Bye-bye.
Yeah.
And that was the president of the Tobago Hindu Society, Ms. Pulwati Bipat, as she gave step-by-step account of her and her family's experience.
So now, before we run out of time, could you call Dr. Fraser, please? We want to bring in, this was a late addition to the program, Dr. Osafo Fraser, who's the county medical officer for St. George West, is going to talk to us this evening about vaccines. Vaccines have begun to be rolled out in Trinidad and Tobago. We have the rollout now of the Sinopharm. We had AstraZeneca, the first round of a month or two ago. And we know that there are some people out there who are a little hesitant to take the vaccine, to sign up to get it. It is a little process. I mean, I've known a couple of people who have made their appointment and had to wait a little while before they got it. But it is one of the tools, one of the major tools that we have to fight this virus. And I think we have Dr. Fraser on the line. Good evening, sir. Good evening.
Hello?
Hi,
yes,
Dr.
good evening,
Fraser.
Dr. Fraser.
Hi, good evening.
Thank you very much. Thank you very much for joining us. We don't have much time, but we can try and get through as much information as we can.
Right.
We understand that you're here to talk to us about vaccines. Can you start off by telling us why the vaccine is necessary, given all the other protocols that most of us have been observing? Why is it important for us to get vaccinated?
Vaccine is very important because it allows every single person the opportunity to protect yourself against getting very seriously ill, and in the worst case scenario, of course, dying from COVID-19. Go ahead.
Sorry, yes. Sorry to jump in there, but what's the importance of vaccine? And we thank you very much for explaining that, because there are some people still don't feel it important. Now, we've had a question asked, and a lot of people been wondering about commingling of vaccine. So can it be done? If somebody took AstraZeneca and somebody say, no, well, Sinopharm better, should be Sinopharm is better. Can we do that?
The recommendation is not to make vaccines.
Okay.
Do not make your vaccines. If you're started with Sinopharm, finish with Sinopharm. And same thing with AstraZeneca.
And what is the protection rate? Sinopharm is a new one. It is out of China. And for those who may want to get vaccinated and Sinopharm is the only option, what is the protection rate of that particular vaccine?
So the WHO, which is the organization that approved the Sinopharm, they have documented 79% efficacy for Sinopharm against very serious illness. And of course, the most important thing is almost 100% effective against death from COVID-19. So those are the big figures that we need to keep in mind.
Right, 79%. And how does it compare then to AstraZeneca and other one? Well, that's the only other one that is available here in Trinidad and Tobago.
Yeah, AstraZeneca actually is around about the same thing in percentage, depending on where you which trial you get. It's between 75 to 79%, 80% in some cases. So it's pretty much comparable.
Right.
Now, some people are concerned, Doc, how safe is the vaccine? Some you hear the conspiracy theorists, but in your expert view, how safe is the vaccine?
All right, so the vaccines have been given to millions and millions of people around the world. We've had some very rare cases of serious side effects. So most of the people who take the vaccine will be fine. Some people get some very mild side effects. When I took the vaccine, I got a little bit of pain and a little bit of fever, but that was it. So most people are going to have a really normal course, and we've given the vaccines to millions and millions of people around the world, and it's very, very safe.
And when you mentioned side effects, what can people expect to feel or experience with both brands of vaccine?
Sinopharm and AstraZeneca have a similar profile in terms of what to expect, and what to expect will be some headaches. Sometimes you get pain at the site where you got injected, fever, body pains and chills. A little bit like if you have the flu, but those symptoms will come on, last for a day or two, and then you're fine again.
Now, some people that would say, so why is the vaccine necessary then? If we following the protocols, we wearing the mask, but still, we still need the vaccine.
Yes, I mean we probably know by now because we've seen it a lot. Even if you get the vaccine, you can still get infected. And what the vaccine is used for is to protect anyone who gets infected from getting seriously ill, ending up in hospital and dying. That is the power of getting the vaccine.
Right, and that's important because we have now restrictive measures again. How confident are you on the ministry that this time, it will have an impact on the rising numbers?
I think it will, and I think we have in Trinidad and around the world, we have seen that once we reduce the movement of people, the infection rates go down. The virus in Trinidad is behaving like it has behaved everywhere else in the world, so I do not expect a different result. I think infections will go down because we've stopped movement of people. So.
Right. And what about herd immunity now? We spoke about that. Would that still be relevant?
Herd immunity is relevant, and obviously the way to get herd immunity is to vaccinate as many people as possible. So the more we push towards vaccinating, is the greater our chance of even not getting anywhere close to herd immunity.
Right.
So persons with comorbidities, we hear a lot about comorbidities in the ministry's press conferences and in terms of reports of persons who have succumbed to the virus. For a comorbidity on NCD like diabetes, how do persons like with those NCDs fare with this vaccine?
Well, both the AstraZeneca and the Sinopharm vaccine are designed for people who are most vulnerable. Okay. So AstraZeneca has a lot more information about what happens if you take the AstraZeneca vaccine and you have comorbidities. Lots more information on AstraZeneca than Sinopharm. But the recommendation from the WHO across the board is if you have a comorbidity, you are more at risk of becoming seriously ill from COVID-19 than any side effects from any of the vaccines. So take whichever vaccine is available to you because that's your protection.
Right. But I mean, it's not just for people with comorbidities, of course, because we have had cases of people dying as a result of seriousness of this virus, right?
And I think that's a very important point, Natasha, because I think when we started COVID-19, a lot of people thought, well, this is just for the elderly and people with comorbidities. But our recent history has shown us that even young, healthy people can succumb to the infection. Yep. So the advice would be vaccinate.
Right. And of course, the elderly. Some people worried about
how safe it is for older persons.
So my grandmother is 85 and she's batting good.
Yes,
Should she still take it?
She should still take it because the elderly are a little bit more vulnerable. And not just because the immune systems are not as strong as a younger person. And so the elderly are particularly at risk. So 85, 90, if you get exposed to COVID-19, your chances of getting seriously ill goes up just because of your age.
Okay.
Yeah.
And if you're just joining us, we're speaking with Dr. Fraser, and he is the County Medical Officer for Health, St. George East, Dr. O. Safo Fraser.
Yes.
And Doc, one more question from me though. Do we hear about other variants and all of that? Are we protected? Would vaccine protect us from these other variants?
The research we have so far shows that there is comparable protection against the other variants. Certainly the variants we've seen in Trinidad is the P1 and the Brazilian one. There is enough evidence to suggest that the vaccines that we are taking and using now, the effect they have against that variant is comparable to the effect they had against the original variant. So confident that we're going to get sufficient protection from those two vaccines against the current variant.
Right. So we don't know if anybody have any questions. You can call us at 622-3937.
I have a
Quickly,
question
if
for
we
the
could get in
doctor.
a couple of questions quickly for the doctor before he leaves. Yes, Natasha?
Sure. I wanted to ask about the two injections, two courses of injections for the vaccine. If someone has taken their first dose, are they really protected, or what? Can you give us like a percentage of the level of protection that exists? How does that work?
Yeah, so once you get your first dose of vaccine, and each vaccine is different, but once you get your first dose of vaccine, at least 2 weeks after you've taken your first dose, your protection, your body's immune response kicks in, and you are protected. But your maximum protection, and that's what the research shows, your maximum protection comes when you take your second dose. Some studies actually quote percentages, but I think the recommendations from WHO stay away from giving a percentage after your first dose, because the idea is you need both doses to get your maximum protection.
And should you still mask and sanitize and do all of those regular things, even though whether you've got your first or both doses of the vaccine?
Yeah, right now the national recommendation for Trinidad and Tobago is, even though you have got your vaccination, you are still required to do all of the measures required to keep people from getting infected, because even though you may be vaccinated, you can still get infected. And if you're infected, you may still be able to pass infection.
Right.
So you want to make sure that you are protecting yourself and your loved ones by not getting infected and passing it on. You may end up not getting very ill, but if you pass it on to someone who's not protected, who's not vaccinated, that person can end up getting very, very ill. So let's continue to do all that we need to do to stop infection and from spreading it.
622-3937. Hello, good evening.
Hello, good evening.
Right, could you speak up, please, so the doctor can hear you as well? You have a question?
Good evening. I would like to ask one question.
Sure.
People who, you didn't go to the doctor, you don't know if you have whatever sickness or anything like that. Is it all right to just go and take the vaccine?
Yes, the recommendation, this WHO and all the international organizations recommend you do not need to test to know if you are COVID positive to take the vaccine.
Okay.
So once it's available and once you fit the criteria for getting vaccinated, you need to turn up and get your vaccine.
Right.
Gotcha. Thank you.
622-3937. If you have another... Hello, good evening.
Yeah, good evening, God. Natasha and the doctor there.
Is that Manu?
Yeah, man.
How are you doing?
Well, I ain't afraid to go and take the vaccine, but sometimes, when you reach that kind of age, it's hard for you to get that kind of point, because, you may have eye problem, you might have how for somebody like me to get the vaccine?
All right.
God, if you could repeat the question for me, please.
He wants to know what's the process to register to get in line for the vaccine.
Right. Okay. Yes. Right now, I think a lot of the numbers all up on the Ministry of Health website.
Yeah.
Right. There are numbers that you can call, you can WhatsApp, and I know eventually, very soon, we're moving to an online format. But right now, you can call the numbers that are available out there. Failing all of that, check in with your local health center closest to you, and you will be guided.
622-3937. Good evening.
Hello.
Good evening.
Good evening.
Good evening. In respect to this virus.
Could you speak up, sir? We're not hearing you.
Oh, in respect to the virus, how long will it take before people get vaccines and things, right? How long it will take before they could get out of this masking and all that? Because I really see they going around free now.
All right, Doc, you heard that? He's asking. He's asking how long after you're vaccinated would you be able to move around as normal without a mask?
Oh, right. Again, that's a national policy decision that the CMO and the leaders of our country will make an announcement on when we get to that stage. Right now, the policy is mask up even though you're being vaccinated. Continue social distance. Continue to sanitize.
Right.
There's no change in that policy as yet.
Gotcha.
Okay.
Because there will be a while until we, as a whole, are confident that the virus is not still spreading. Right?
Yeah, and I think we have seen other countries start to drop their policies about wearing masks if you're vaccinated and so on. One of the things I would say about those other countries is that they have a lot more people vaccinated in those countries than we do in Trinidad. Yeah. So people are using different reasons to change their policy.
Right.
Yep.
Have one more. Hello, good evening.
Hello?
Good evening.
Good evening.
Right, good evening. My daughter's calling all the lines and nobody answering to make appointment with me. I am 77 years of age. I have heart failure. I had a bleeding colon, a bleeding stomach. I have a testicle and 2 arteries plugging in my heart. And nobody answering at all that I could get an appointment. So I went to the Aruka Health Center. They did not even listen me to say, okay. Oh, the Ministry of Health. They're not answering. And I'm in this kind of condition. I'm going to get it. They didn't give me none. I went to the Central Health Center. They said they have to answer phone. And nobody answering the phone. So what I should do?
Ma'am, thank you very much. I'm
Thank
sure
you
that
for
complaint
that.
is registered. Look, I know there are some challenges because I hear a lot of people speak about that, but I'm sure the ministries will be looking to rectify that and tweak that, right?
Yeah, that's correct. And I know the minister has said that publicly, and we know for sure that he's trying to make every effort to get the appointment system as smooth as possible. And the full reason for that is we want people to be vaccinated.
Right.
So we're making every efforts to work on that. I think one of the things that I would say about that is that it's a good sign for us from the standpoint that people are willing to take the vaccine.
Yes, yes. Well, look, before you go, some 2 people asked the question: is medical advice necessary? Should someone seek medical advice before taking the vaccine? And for someone who suffered a stroke, is it advisable to take the vaccine? So that's 2 questions there for you before you go.
Right. One, the national guidelines are that if you have any comorbidity, you are being treated for heart problems, anything like that, and you are concerned, check with your doctor before going to take the vaccine.
Yep.
That's good advice.
Yes.
But the recommendation for the vaccine says even if you have comorbidities, the vaccine is for you.
Right.
So that's one thing. Just to clear that up. Even if you have comorbidities, the vaccine is for you. But if you're being treated for a particular condition, it's always a good thing to check with your doctor before you go and get the vaccine.
Right. Thank you. And the person wondering if they had a stroke.
Right. And if you have a stroke, same thing. The stroke would be considered a comorbidity or illness.
Just
the
wanted the
recommendation
person to
is
make
that
sure.
yes, you can take the vaccine, but again, it's useful to check in with your regular doctor just to make sure that everything is fine, and you can go and get the vaccine afterwards.
Yeah. And is it so that when you do go get your appointment and you go, you will be asked certain questions about your health and the medicines you're taking by the nurses anyway? So there is that extra layer of investigation before the vaccine is administered, yes?
Yes, correct. And I just want to repeat that point, which is even if you have some illness or you have a comorbidity, that's not a reason not to get the vaccine. In fact, it's a reason to get the vaccine. Right? Some people are worried with the fact that I have diabetes or I have pressure or I'm old. all of those things are actually reasons to get the vaccine, because those are the people who are most at risk of becoming very seriously ill if you contract COVID-19.
All right, Doctor, thank you very much.
Thank you so much.
If you don't mind, Doc, if you have some time to spare this evening or maybe tomorrow, please go. You can visit our Facebook page and answer some of the questions that I'm sure we see some more people asking. If that's all right.
So, yeah, sure.
Okay, so we'll send. We have your we have a number, so we can send you the link, and just so that people can, because sometimes people will ask a question and they don't get it answered because of us rushing for time. So please, if you don't mind, you can just do us that favor and answer some questions when you have the time.
Okay, sure.
All right.
Thanks again, sir.
Thanks again, Doc. Take care.
Thank you very much, guys, and Natasha.
The same to you, sir, and all the best to as you all out there on the front line fighting this war.
Yes, thank you very much.
Okay, take care. Bye-bye.
Right,
and we thank, of course, retired Major Al Alexander and the team, Ms. Alcantara and Curlane and all the group, the team at the communication team and the Ministry of Health for hooking us up with this interview this evening. Well, retired Major Al Alexander for hooking us up, and thank Dr. Fraser for his time. We have a couple of videos to show you quick before remember we have to be out of here promptly at 8, so, or if not before.
Yes. Could we start with the video Shortman, the vaccination of health workers, and as we were just
before Shortman start, LJ wants to thank the staff took care of him at the hospital in Escova, right? I think
yes.
Right, and he's encouraging people, if you have families who can donate, you yourself can donate some Gatorade and all of these supplement, not energy drinks, but these replenishing drinks. You can drop it off for them, please, because they're working around the clock, and a little donation to them wouldn't kill anybody. Nice box of Gatorade, and Cora. LJ was in Cora, so he would like to say thanks to the staff at Cora too for looking out for him really well. So let's go to that video. Shortman, vaccination of health workers. This by the World Health Organization.
For almost 18 months, health and care workers all over the world have stood in the breach between life and death. They have saved countless lives and fought for others who, despite their best efforts, slipped away. We owe them so much, and yet globally, health and care workers often lack the protection, the equipment, the training, the decent pay, the safe working conditions, and the respect they deserve. In January, I issued a challenge to see vaccination of health workers and older people underway in all countries within the first 100 days of the year. That target was very nearly achieved, but the number of doses available to COVAX remains vastly inadequate. There is no diplomatic way to say it. A small group of countries that make and buy the majority of the world's vaccines control the fate of the rest of the world. The number of doses administered globally so far would have been enough to cover all health workers and older people if they had been distributed equitably. We could have been in a much better situation. I understand that every government has a duty to protect its own people, but right now, there is not enough supply. I'm calling on member states to support a massive push to vaccinate at least 10% of the population of every country by September, and a drive to December to achieve our goal of vaccinating at least 30% by the end of the year. Sprinting to our September goal means we must vaccinate 250 million more people in low and middle income countries in just 4 months, including all health workers and the most at-risk groups as the first priority. These are the minimum targets we should aim for. A safer world is not a zero-sum game. It is the opposite. If anyone is left behind, all are held back. If the most vulnerable is first to be protected, then we all win.
Right, so that was the Secretary General of the WHO with a very important message about vaccines. And we thank Dr. Fraser for giving us that information, read the vaccine. And again, to reiterate, if you do have a comorbidity, you have a non-communicable disease, you have high blood pressure, you had a stroke, you have heart issues, you've had cancer, all of these issues are the reason why you should get vaccinated. And if you have any doubts, check with your doctor first to make sure that everything is in order and register to get your vaccine. I want to share another video, and this is a topic that hasn't been discussed at all. I haven't seen it being discussed at all. Is that this is about the link between factory farming, animal agriculture, and COVID. And it's just a snippet of what is happening in Europe and America, but it's food for thought as to how this virus came about and what we should consider doing differently going forward. This is video G, Shortman. So when you have that ready, let us know.
And we will leave you with that, because after which we have to leave here promptly at 8. So we might as well say good evening to you right now.
Okay.
And as we leave, we thank you once again for joining us and learning something. Thank those who joined us via Facebook. We have a special corner for our radio audience because we haven't chatted with you for quite a while.
Indeed.
But yes, so we have to spare some time for you. But we want to leave you with this, and we will deal more next week, please God, with some other matters that I wanted to raise this evening. So as Natasha said, we'll leave you with the correlation.
COVID and factory farms.
Right, factory farms. And then COVID, of course, play a little strange from GB's latest contribution to the COVID. Right, we will rise again. So, folks, thank you very much. You all understand what's happening Monday and Tuesday, right? Please don't get the police involved again, right? Stay home if you're not essential. Please. It's as simple as that. Okay?
Or do whatever you have to get done between the hours of 6 and 10 a.m.
Yes.
Please.
Please, we beg you hard. Thank you very much, folks. God bless you all. Stay safe. Have a great, protective, stay home week.
Enjoy the holiday.
Enjoy the holidays. And happy Indian Arrival Day to our Eastern brothers and sisters. Thank you, folks. We're gone. Be safe. Take care.
Good night.
Good night.
COVID-19 is causing so much pain in our lives. Of course, we're focused on the here and now, but we don't ever want to live through something like this again. We shouldn't wait to lower the risks of future pandemics. As a start, we have to understand the cause of this one and the ones before, our treatment of animals. Ebola, SARS, MERS, avian flu, and other deadly outbreaks are all linked directly towards our treatment of animals. The same is true with the crisis we're in now. The virus that causes COVID-19 has been linked to a wet market where wild and farm animals, both dead and alive, are bought and sold for people to eat. I know it's easy sometimes to point outward and to blame other people, other countries for the situation we're all living through today. But these markets are not the only places capable of spreading disease. Right now, here in the United States, animal factory farms are breeding grounds for disease, which pandemic experts warn could cause the next global outbreak. Just think about it. Science aligns with common sense. As we're told to stay at home and avoid large crowds, we're simultaneously cramming tens of thousands of animals wall to wall inside giant factories. It's been called by public health officials an ideal laboratory for pathogens to thrive, recombine, evolve, and then eventually affect people. In these factory farms, it's standard practice to force animals to live in small, filthy cages. Mother pigs are locked in iron cages so small they can't ever turn around. Egg-laying chickens are packed into tiny cages that prevent them from even spreading their wings. Baby veal calves are confined in crates that barely allow them to move an inch. These animals suffer in these cages for nearly their entire lives. For public safety reasons, let alone to stop this cruel treatment of animals, legislators need to pass laws mandating factory farms move to more humane, safer models by phasing out extreme confinement. 12 states have already passed laws to begin to do just that. It's a start. Now we should always look to science, and eliminating cages of farm animals won't guarantee that we'll prevent the next global pandemic, but it's a huge step in the right direction. The food industry also has a serious role to play to reduce disease risks. Here's how. The industry should accelerate its movement away from its reliance on meat, eggs, and dairy in favor of putting plant-based foods front and center. We already know eating more plant-based foods can lower the risk of type 2 diabetes, high blood pressure, obesity, cancer, and heart disease. It's not only beneficial to our dietary health, but it will also reduce the need to raise farm animals by the billions and risk future zoonotic disease outbreaks. This crisis has been a global nightmare. Let's learn from it to finally take action scientists know we should be taking to at least reduce the risk of perhaps even future worse pandemics to come. We need policymakers and food companies to take urgent steps to address the ticking time bomb that is current farm animal confinement systems. All that is required is the will to change, and it's vital that we take that action now.